Hey everybody, Randy Kurtz here for the ISB, and no, I'm not attempting to be the centerfold of the next ISB Base World calendar, but rather to demonstrate a couple of things that I've been thinking about that can affect the wrists in our everyday lives, besides our playing lives, and in this case, talking about exercise. So when we're doing push-ups, which is one of the things that may commonly be done to stay in shape, we like to set up our bodies so that we are directly over the wrists. And what that looks like is this. We don't want our bodies pushing forward where the wrists are in such a way where there's going to be more pressure on them here, but we want to be well balanced over our bodies like this. Now when we go do the push-up and come up, we should still retain that same balance so that the wrists aren't angled forward. Many times this isn't so easy to do because we're holding a position, we may be uncomfortable, we're thinking about how our body feels, we're thinking about how many of these push-ups do we have to do, we're thinking about we can't wait till they're done, things like this. So we may do the push-up and come up like this. Again, not good, pain in the wrists. We attribute it to the discomfort we're having all over perhaps, and don't pay attention to that. So, thing to think about is keeping these wrists straight as possible during the course of the whole exercise. Same thing with yoga, another good thing to do. When we're doing the most common thing, which would be downward facing dog, one of the yoga positions, we get up like so. And in this position, there's really no problem with the wrists, as you can see. You're not going to go down enough where it's going to make a difference in the other way, but you're not bent forward. However, once you do this position, you may then come forward into another position, which is very common. And in this position, as you can see, the wrists are pressed forward and there's going to be excessive stress there. So when you're doing your downward facing dog and you come up into this position, again, important to keep in mind, you don't want those wrists to be stretched forward, thereby giving you discomfort and causing problems. Another thing that I've been thinking about is medications. Now I'm not going to, nor am I qualified to give advice on medications because I don't dispense them, I don't prescribe them, it's not in my scope of practice, so this is not advice. However, many people are on different medications for different things. Could be cholesterol, could be anxiety, pretty common medications out there that a lot of people are taking, blood pressure, etc., etc. Important to note that whether prescription medicines or herbal medicines or supplements may have side effects that you may attribute to being an issue with playing. The point is that if there's a side effect with some medication that you're taking that is making you feel muscle cramps, tightening, things like this, and you think it might be your playing that's causing that, check your meds because these are very common side effects and the problems that you may be experiencing may not be caused by your playing. They may be caused by these meds, and therefore you may seek treatment or try to alter your playing when it may be unnecessary, and this may cause problems to become worse or create problems that were never there. So again, this is not advice on medication, and if you do have any questions about medication, you should speak to your doctor. But sometimes muscle cramps and things like this are going to be issues caused by those meds that, again, if you feel that they're because of your playing, you may make unnecessary changes or seek unnecessary treatment for that. So check that out, and if any questions at all, ask your doctor. Randy Kurtz for the ISB. Looking forward to seeing everybody at the convention. I'll be lecturing on Saturday, I believe, and looking forward to seeing everybody there and all the other lectures, and sounds like a lot of fun. Will be a lot of fun. Randy Kurtz signing off. Always available, drkertz at drkertz.com. My website, www.drkertz.com. Any suggestions, please keep them coming. My book, always available from the Society as an ebook from my site. See you next month.